Mental health and addiction are not always linked, but they often can be. People who struggle with mental health issues like depression or anxiety, or even things like bipolar disorder or schizophrenia, can be more likely to abuse substances, sometimes as part of their illness or sometimes as a way of trying to deal with the symptoms that they're having. Similarly, people who struggle with addictions, whether that be with alcohol or with cannabis or prescription drugs or opiates, report higher rates of things like depression and anxiety. So when people are struggling with both mental health concerns and addictions related concerns, there's a term for that. We call it a dual diagnosis. It just means that people have both issues going on at once. And really, in that context, an individual benefits from a professional assessment to see what the interplay is and how we should address them. Sometimes it makes more sense to start addressing the substance-related concern or addiction concern first. Sometimes it makes sense to address the mental health concern first, but oftentimes we try to treat both of them in parallel or at the same time. The best evidence for treatment for people with both mental illness and addictions is actually trying to address both at the same time. So concurrently treating both conditions in an integrated fashion. Often this takes a multidisciplinary team, which can involve therapists and counselors, along with psychiatrists or physicians. It may involve medication alongside therapy, but it really requires a team and a good thorough assessment to decide what the best course and staging of treatment is. It's a long process. So really making yourself available and being open and supportive generally is probably the best thing that a family member or a friend can do for a loved one that's seeking treatment.